Good afternoon, everyone, and welcome. My name is Elliot Williams, and I'm the training manager at the National Press Club Journalism Institute. Thank you for joining us. Before we begin, I'd like to note that we are recording this program. Highlights will appear on our website and in our daily newsletter for journalists, which you can subscribe to using the link in the chat. Reporting on underserved communities that are suffering or dealing with overlooked public health issues can be daunting, especially if you might be considered an outsider or lack standing connections with residents or community leaders. Of course, there are many considerations to make, including the safety and privacy of your sources and not wanting to harm the people who have entrusted you with their stories. This is where community health workers often come into the equation. They're typically the first and most trusted points of contact in the communities they serve. And as journalists, we know that telling powerful and accurate stories can't happen without gaining the trust of those who are closest to the issues. Today, we are joined by two speakers who bring deep experience and understanding to this conversation. Dr. Bechara Choucair is the Executive Vice President and Chief Health Officer at Kaiser Permanente, where he leads efforts to improve health outcomes for more than 12.5 million members and the 68 million people who live in the communities it serves. And Denise Smith, who is the inaugural Executive Director for the Association of Community Health Workers. She is a visionary leader and national voice for advancing health equity. Together, they'll help us understand how journalists and community health workers can collaborate to tell more informed, impactful, and ethical stories. Bechara and Denise, thank you so much for joining us.
Thank you, Elliot. Really excited, Denise. Good to be with you on a panel again.
So we'll start with a moderated conversation, and then we'll open it up to your questions. But in the meantime, feel free to submit any questions you have using the chat or the Q&A function at any time. Your questions will be addressed at the end of the program. And in the meantime, you can also let us know where you're tuning in from. So let's start with the broad view of how public health and healthcare delivery systems fit together. That's something that throughout the course of our public health reporting fellowship, we've been trying to decipher and get clarity on. So Denise, why don't we start with you? Where do community health workers fit into that intersection between public health and healthcare delivery systems?
Yes, community health workers are best understood as local people addressing local problems in local communities with local solutions. I am a community health worker, and so I'm really proud to be here and talk about my colleagues, my friends, and the members of the National Association of Community Health Workers. CHWs are a unique, trusted, community-based workforce, as Elliot mentioned, with significant diversity in language, geography, culture, ethnicity, and lived experience. We have over 6 decades of evidence of our effectiveness implementing our roles and services in public health, clinical care, and social needs. And so some of the ways that you'll show community health workers sort of showing up in those spaces, in those 3 different areas. Sometimes it is direct service, doing blood pressures, delivering food, running a soup kitchen or a clothing closet, helping with health education in chronic disease, infectious disease, building capacity of people so that they can access and navigate services and systems on their own, find the information and resources that they need, addressing cultural competency and the need to make sure that services are respectful of individuals and families, collecting data to do, community health assessments and develop planning, and also a range of policy and advocacy roles in community.
Wonderful, Denise. And Bashar, do you have anything to add to that about that intersection?
Yeah, maybe. Thank you, Denise and Elliot. Thank you for hosting this conversation. Maybe I'll start by just saying how public health and healthcare for the longest, for decades and decades and decades, have functioned as 2 independent disciplines or 2 unique disciplines that they get to interact every now and then when there is a public health emergency or a healthcare emergency. And then once that emergency goes away, those 2 disciplines go back to their own corners and then keep on moving forward. And that's a problem because when you think about health, you think about it as a continuum that starts in public health and ends all the way in tertiary care. So it's a, the way we should be looking at health is by looking at that full continuum. And we need to be building and enhancing more and more bridges between public health and healthcare. And look, those two disciplines come together as good as they can when there is a public health emergencies. We've seen this, when we had an H1N1 pandemic, when we have a Zika issue, when we have the H1N1 most recent pandemic. And it's so easy after that public health emergency kind of subsides for these disciplines to go back into their corners. And I think we have, as a country, we have to continue to try to figure out how do we bridge that gap? How do we build on those bridges? And there are many, many ways that we need to do that and we need to support that. And community health workers play a critical role in making sure that a bridge is there, that connective tissue that bring these two disciplines together is there.
Absolutely. Now, I want to get to where I want to jump right in with how journalists can best engage with community health workers. But before that, I kind of want to address any misconceptions that you think journalists have of community health workers' role in public health and vice versa. Are there any sort of misconceptions you think that either the public health community at large or community health workers have of journalists in the press and their involvement in covering these issues?
Yeah, I'm happy to jump in and just continuing the conversation that Bechara has brought into the space. Community health workers are vital because systems and sectors often do not um, play well together, are not sufficiently integrated in their eligibility, in the way that we pay for these services, in the way that people navigate these services. But when you think about the whole health needs of an individual or family, you know that there are components that are social, those that are clinical, right? And those that address public health, particularly prevention, right? Which is where we want people to exist, right? We want people to have the capacity, the literacy, and the access to services, whether they are immunizations, right? Or whether it is education or healthcare coverage to prevent downstream disease, poor health status, poor health outcomes. And it is often the gaps that have been identified, right, by research studies, by wonderful public health or primary care champions that has allowed community health workers as a profession to step in, right, and talk about the way that we bridge these systems. But I just want to say one more thing about misconception for the profession, because I am a CHW, so it's I think important for me to do so. In the United States, we place a really high value on clinical care professions, advanced academic achievement, and specialties. We really love specialties. And so community health workers are very often referred to as lay workers. I'm going to call out some things, some particular phrases that I would love for you to stay away from and call out with your colleagues. A lay worker, I've heard paraprofessional quite frequently, right? And I want you to imagine how that hits an individual who gets up every morning and shows up at work every day, right? Implementing their job description, okay? We're all doing our very best, and the idea is that we are working at our really highest scope. Finally, as Bechara said, this misconception about being a lay, sort of ancillary, marginal sort of worker in healthcare or public health was truly tested and found wanting in the COVID pandemic, right? When global organizations and governments and systems were calling for this rapid scale and integration of the profession. So just some things to think about.
Yeah, and maybe to add, I think Denise is spot on. Maybe to add a couple of things here. Our healthcare delivery system is so complex. I mean, everybody who's on this call will probably agree that we have a very complex healthcare delivery system to navigate. We've built our healthcare delivery system to treat illness, not necessarily, it wasn't built with the main purpose of preventing disease. So I think it's really hard. Two things to point out here. One, it is really hard for individuals to be able to navigate the healthcare delivery system on their own. So having a key role for the community health worker to support people in understanding that system, navigating it in the most effective way is extremely critical. So that's one. The other thing I'd want to add is something Denise alluded to. We know that what impacts health happens in our communities. It's where we live, where we play, where we study, where we pray, where we work. And if that's truly what impacts our health, community health workers then play an even more important role in those communities where we live so that we can prevent disease, we can control chronic disease better. And that's why the role there is so critical. It's not just within the care delivery system, it's in our communities where people live. And look, over 80% of what impact our health happens in those communities, and community health workers can play a significant role there. Again, healthcare system that's built to treat illness as opposed to prevent disease. Community health workers can help us really advance the importance of adding the value that we bring from living healthy lives in our communities.
Now, I want to get into some of the issues that we've been hearing from our constituents and from journalists that we serve. Some of our fellows included, they've reached out to community health workers or community health centers and folks that would have, typically wanted to share stories, especially positive ones, are feeling less inclined to draw attention to their work and the great work that you're mentioning under the, current political environment. I'll just put it that way. How can journalists break through and reach and tell these stories while keeping these valid fears of retribution in mind? And Denise, I'll go to you first for that.
Yeah, I first of all, I just want to thank everyone who is desirous to tell the story, right? And want to encourage you that now more than ever, storytelling is a way to humanize data. It is a way to create a picture that hopefully can sort of tamper down some of the politics and remember that what we are talking about are the lives of children, families, adults. So I think storytelling is a very powerful tool to do so. And I really I agree first because we hear some of this from our membership. So I want to sort of corroborate what you are experiencing. And I want to say that I believe a really key way to understand this barrier that CHWs might be experiencing in the desire or sort of telling their stories is around the risk that can be brought to bear for their clients, for their patients, and for their community members. As I mentioned earlier, as a CHW, what we have first is trust. What we build first is relationship. And that takes time, it takes transparency, it takes vulnerability. And so in that space, we are connecting with people who could possibly be at an incredible stage or moment of vulnerability or high risk, whose lifestyles and behaviors are often targeted, who are considered or looked at as expendable, whose poor health can be attributed to poor choice, right? Laziness. Okay. How do you combat that? For me, this is about history and it is about truth. And I just think in the United States, we're a young country. We don't often look back at the way that we tell the story of health. But often when I'm speaking about this, I think about the 1968 Kerner Commission. That was not necessarily a health story, but what it uncovered in the United States in the late 1960s are those infrastructures, those policies, those societal norms that mediate or moderate health or well-being. And there was a real warning in that report that continues to show up in everyday life today. I think about the 1985 Heckler report. It's a report I actually go back to often, where Margaret Heckler, who later, that report helped to establish the Office of Minority Health, called for an assault on health disparities. Right. And I often ask the question of my partners, have we seen an assault on health disparities? Right. That was the call almost 4 decades ago. Right. Or I think about the 2002 report from the Institute of Medicine, right? The unequal treatment report. Um, all state, all of these reports state that poor health is a function of zip code. It's a function of race. It's a function of income. It's a function of education. And it's a function of the policies that govern these things. So when you're asking CHWs to tell the story, you might be thinking about a very sort of specific story between the CHW and their patient or CHW and their client. The CHW is likely going to bring in their level of familiarity with the history of that local place, right? The history of that community, the history of that barrier, that disease state, that issue. And the question is, do people really want to hear all of the truth that comes with their story? So I think some of the hesitancy is around CHWs wanting to tell the truth of that story, of that issue, and how it came to be.
Thank you, Denise.
Thank you, Denise. Beautifully, beautifully said. So I think Denise pointed out, kind of why it's so important to be able to tell those stories. And I'll share one concrete example. I served as the White House vaccine coordinator in 2021 for COVID. And I was working with people across the country to make sure that people are getting vaccinated. And then we started to see vaccine hesitancy go up and starting to see people not wanting to get vaccinated. And we have used doctors, we have used nurses, we have used the president, we've used everybody to kind of promote the importance of getting vaccinated. And yet what we knew at the time was that people trust people they know. People trust people in their communities, their neighbors. And that's why we really put a lot of emphasis on the role of community health worker to spread the word about the importance of getting vaccinated. And I got to meet so many people across the country, so many community health workers who've done amazing job in knocking at people's doors, talking to them, answering their questions. And I'll share one particular example from here in my backyard in San Francisco. There's this one woman, Felicia Thibodeau, who I remember having long conversations with her, who took it upon herself to go knock at people's doors, have conversations with people, answer people's questions about the vaccine. She even had her own van where when she have conversations with folks and people are ready to get vaccinated, they'll get on the van with her and she will literally drive them to the vaccination center to get them vaccinated. And Felicia by herself got at least 1,251 people vaccinated in San Francisco through that effort that she's done. Elliot, I think for me, stories like Felicia's stories are inspiring, not just to me, but literally to thousands and thousands and thousands of people across the country. And it's those stories that we need to highlight and lift up because at the end of the day, we really have to strengthen the trust of people have in our care delivery system and our public health system. And those are the stories that tells you how effective that function is in making that happen.
Absolutely. And Bechara, just to build on that, a lot of journalists sometimes can worry about being extractive or breaking trust by coming into a community and, even when they're doing deep reporting, ruining sort of an experience for people who want to share their story in the future. How can journalists think about and do a great job at building trust without violating privacy of patients or coming off extractive? Are there any like don'ts or do's for that for journalists?
I think this is where it's important to build the relationship with the community health worker, build the relationship with the patient that they're telling their story, make sure the patient and the community health worker understand, the ins and out, have the clear understanding of the consent, and be part of that story. And I think that would be really, really important. I think the other piece that's really important, I've seen so many journalists do this so well, is being able to lift up from that individual story and then be able to back that up with facts and data points. And look, we know as a country, we spend so much more on healthcare than any other developed country in the world by far. We spend, I think in 2023, we were spending on average $13,400 per person per year on their healthcare. On average, similar countries spend about 7,200 or something like that. So it's like we spend twice as much. And yet, when you look at our life expectancy is not as good as some of the other countries that spend less. So we know there are a lot of data points. We know the work of community health workers is impacting our total cost of care. So when you kind of take that individual story, highlight that story, and then be able to back that up with data points, research, evidence, I think you have a good story to tell.
Denise, do you have anything to add to that on not being extractive in telling these stories?
You know, um, I would say to just remember and have some alignment on the why of the story, right? Like, why do you really want to connect with community health workers? I think the motivation is really important, and I think you want to be transparent. I think you should agree on the how, the how of the story. How do we want this story to positively impact, right, the community from which it emanates? We, as I mentioned, we want people to be really conscious about the way that their story can impact policy, partnerships, right, or the politics of local communities. So I think that's something that we want to be really aware of. And also, just sort of the when, I would argue that from our perspective, we really like to see collaboration in that storytelling. So I think we want to make sure that the community health workers or those who are going to be impacted, if it's patients or clients, have an opportunity to review that story, right, and really give feedback. Those are some of the ways that I think we can slow down the process or really embed the voices of community health workers. I think the last piece I just want to say is sometimes it is really a question of language. As I mentioned, oftentimes I see people talking about how CHWs can be used. And I understand that for some professions, that might be really normalized to say, well, we're going to use this or sort of use that. That is truly offensive to community health workers because it's us, like we're the intervention, it's our relationship, it's the time that we spend with the client. So being aware of the language and how it will hit the local community, and whether or not it will benefit them or sort of put folks at risk is also something to remember.
That makes a lot of sense. I'm going to get to our questions from the audience, and we have several here, some great ones. So this one is for you, Denise. What are the most respectful and effective ways journalists can approach community health workers when reporting on sensitive issues? And I know you did just mention a few of those. So I'll add one follow-up to that from the same person. How can journalists ensure they are not unintentionally putting community members at risk when telling their stories?
Okay, well, I'm sure folks have heard this old adage. I think of a whole lot of stuff that my grandmother used to say. And so I'm sure this has been passed around the planet, that no one really cares how much you know until they know how much you care. I think that applies to journalists, to storytellers, from different mediums who want to come in and sort of know there's a rich story of survival, there's a rich story of sort of overcoming obstacles, there's a story here to really come back to, yeah, but why do you want to tell that story? Right? What is that story going to do for you as a journalist? Right? we might want to tell the story because we desperately need funding, right? But you might want to tell the story just to sort of elevate the data, right, of poor sort of health status. And so maybe the story is not fully represented in the way that CHWs might want. Again, I think the motive is really important as you're developing the story. And you make sure that you don't harm people when you involve them in the development of that story. If I can just be totally transparent, Bechara and I were just working on an article together that was recently released. And I don't know how many versions there were of that story. I want to say 9 or 11 or something. And we were never in the same space and time, but we were collaborating. We were looking at the language. We were, talking about the flow of the story and what were we going to highlight and what were the examples, right? And even though we wanted a really sort of pithy, you know what I mean, sort of a story that people could read in 5 or 7 minutes, the way that we told that story was really important. And so, Bechara and I have had a few interactions, but that's just an example of the way that myself as a CHW can come in and say, gee, I wonder, could we change that phrase? Gee, I wonder, could we say this first before we sort of move to that place? And those moments actually help to reflect the way that community might want to talk about or represent that story.
Yeah, maybe to add one thing. Thank you, Denise, for sharing that. Now you remind me we should probably put a link to that article that we put
Please
together
do.
for the chat. One other thing I would add, Elliot, here is we have a tendency in this country to medicalize everything. Like it's so easy for us to just kind of think about things in a medical sense. And I think what you're hearing from Denise and what I've learned over the years is we have to actually demedicalize a lot of the work that really needs to happen to improve health in this country. And telling the community health workers stories and their role in the community. I want to go back to how Denise started defining what a community health worker. It's somebody who's local, working with local people and local communities on local problems and finding local solutions. You didn't hear her say, in the hospital or in the doctor's office or in the emergency department, because this is truly about how you demedicalize those stories. And for the journalists who are on this panel, being able to take that angle is really, really important.
Thank you. So we are quickly running out of time. So I want to get to a few more questions here. Someone asked, what advice do you have for reporters trying to understand complex public health data while staying grounded in real community experiences, kind of building on Bechara, what you were just talking about?
Yeah, well, I'll start, and then Denise, please help here. We tend to have complex stories to be able to tell. We have complex data sets, really difficult to be able to tell the story. And honestly, we really depend on journalists to help us take these complex stories and put them in a way that actually makes sense and resonate with people. I don't know if I have a magic solution, Elliot, on how to do that. But I think having the conversations with people impacted by these data, people who are generating the data, and really thinking about the impact of these complex public health issues, complex data sets on daily lives of people would be a really important angle to be able to tell.
Absolutely. I want to kind of get to some sort of practical resources, tips. Are there any, go-to resources either of you can share for journalists, for community health workers? And I'll just follow that with, what are the best ways for reporters to find community health workers to talk to in the first place? I know that sometimes it can be difficult even making that initial outreach.
Oh, yeah, I love that question. Thank you so much. So I'll start and then we'll sort of pass around. First, I want to say that the National Association of Community Health Workers, we are a network of networks. We have members in all 50 states and most of the US territories and freely associated states and about 35 indigenous nations. Included in that membership are about 99 what we call CHW networks. These can be local, state level, regional alliances, coalitions, formal state associations. Okay. groups of CHWs who have come together to do a variety of different things. Let's say that. First of all, you can find a complete list of all of those organizations, training institutions for CHWs, networks, associations, alliances, coalitions on our website. The information is free. Right? You can go, you can find a cell phone number, a website, an email address, a Facebook page, so that you can begin to look to see where the CHWs have posted. We're doing a local event, right? I mean, one of the best ways is to offer, could we amplify this event? CHWs have their own state advocacy days. They have trainings throughout the year. They are organizing through conferences and summits and health fairs. And so if you want to find a local story, you can go to where CHWs are already organizing. In addition, one of my colleagues is going to share a few pieces of information. Some of it is data. Some is just sort of language that we've collected from our membership. We have a data for action series that we created. I think it's going on year 3 now, which is just descriptive data on the profession from 857 zip codes, 51 different questions. There are infographics there. So if you want a starting place to sort of look at data created by CHWs for CHWs, that's a place to go. We also have something called the 6 pillars. During that global pandemic that we all remember, when we were learning about CHW's roles to respond and protect communities, the number one question people asked me is, who are they? Why do they have so many different titles? Why do they work in so many different organizations? And so the 6 pillars is just a way to sort of wrap your arms around the diversity of this profession. It's really short. It has 6 points to it. And, you can use that also as a resource. And then the last thing I'll say is this August, we will be implementing year 3 of something we call CHW Awareness Week. We ask thousands of CHWs. Last year, we had CHWs from 30 different states participate to celebrate their local stories, right? To commemorate the achievements that they've made, whether it's state legislation or new funding for programs or significant partnerships. And you can tap in to the Awareness Week sort of happening by connecting with CHWs. They will want to tell their stories during that week. And again, there are free resources. And if you go to that webpage, you'll be able to see who's participating, and connect with those partnerships.
That's great. And a lot of those, sorry, Bechara, I just wanted to point out our chat where a lot of those are. And we'll follow up with an email with resources. Bechara, go ahead.
I was going to say Denise's list is exhaustive and it's great. The only thing I would add is I would encourage folks to check out the Common Health Coalition. We brought this coalition together a couple of years ago to bringing the public health care system together with the public health system to kind of really build those bridges between public health and healthcare. And the Common Health Coalition has over, I think, almost 200 members now from across the country, organizations that truly believe about the importance of bridging public health and healthcare. And one big focus for that coalition is the role of community health workers. So if you go to commonhealthcoalition.org, you'll see tons and tons of information about community health workers and just in general about how do we build bridges between public health and healthcare.
Wonderful. Well, I think that's a great place to wrap it up. I want to thank you both for in a short amount of time giving us a lot to work with, a lot to think about, and some action items and resources. I also want to thank our audience for your great questions and just for your time. And Denise, Bechara, thank you for your expertise. We'll share a link to the recording soon, along with the resources in the chat and shared during this conversation. The National Press Club Journalism Institute provides free or low-cost training for journalists and communications professionals with the mission of powering journalism in the public interest. If you'd like to support us in this work, we hope you'll consider making a donation today. And please spare a few minutes to fill out a survey that we'll send in that email and tell us how we did today and help us improve our programming. We're pleased to present today's session with the financial support of the Common Health Coalition that Bechara just mentioned. And we want to continue these programs. We have a few more throughout the rest of the spring and summer. So stay tuned for those. And thank you for joining us. Thank you, Denise and Bechara, for your time.
Thank you, Elliot. Thank you, Denise.